to see about what are the possible important questions will be asked from cardiovascular system for nursing officer exams for Norcet aims, Jipmer, PGI, ESI and NCLST questions. Let's begin. The first question of the topic is the nurse should withhold digoxin if young child, notice the point, it is young child, okay, apical pulse is above 120 per minute, above 90 per minute, below 90 per minute, below 120 per minute. The answer is below 90 per minute. Why? What is the reason? The reason is it is a cardiac glycosides. So action is it will increase contractility of the heart by reducing heart rate. Okay, so it reduces heart rate, that's why we should stop. Okay, if it is adult means the below 60 to 70 means we should stop. 60 to 70 means we should stop. Okay, so coming to the mechanism, its function is to be used for treat atrial fibrillation, atrial flutter and congestive heart failure. The mechanism is sodium potassium ATPase. Okay, the side effects includes usually tiredness, fatigue, anxiety, hallucination. Sometimes digoxin causes toxicity, that are visual disturbance, nausea or vomiting, arrhythmias, electrolyte imbalance, and can be worsened by other medication also. Okay, consider these points: visual, nausea, arrhythmia, electrolyte imbalance. These are the important thing. So if toxicity happens, what are the drugs to be kept ready? ACB inhibitor and beta blockers. And these drugs should not be given to ventricular fibrillation patient. Okay, next question. Nurse should know normal digoxin level should be 0.8 to 1.6 nanogram per ml, 0.5 to 1.5 nanogram per ml, 0.5 to 2.0 nanogram per ml, 0.6 to 1.8 nanogram per ml. The answer is 0.5 to 2.0 nanogram per ml. Sometimes they will ask 0.3 to 1.9 nanogram per ml. Okay, the answer, both answers are correct. Next, the nurse should know antidote for digoxin is Digibind, Digifab, Atropine, both A and B. All we know digoxin antidote is Digibind, but Digifab also antidote for that digoxin. So please try to remember that. Next question. The nurse should closely monitor for digoxin toxicity because dash will potentiate digoxin toxicity. The answer is hypokalemia. So low potassium level will cause us digoxin toxicity more. Coming to next question, a pediatric nurse should have knowledge about AST that opening is near the center of the septum is AST succidium, AST premium, that is osteoperidium, ostium secundum, primum, sinus venous defect, ostium septium. So answer is ostium secundum. Okay, AST1 also called as osteopremium, P for premium 1, and its opening lower end of the septum. So it is a lower end, opening near the center is secundum, sinus venous defect, that is opening between the superior vena cava and the right atrium. Okay, so please try to remember AST1, 2, 3. The nurse caring for coagulation of aorta child in neonatal care unit should aware that blood pressure is higher in the upper extremities than the lower extremities. Blood pressure in the pressure is higher in the lower extremity than the higher extremities. Blood pressure of both extremities are same. Blood pressure for right extremity is much more than the left one. The answer is blood pressure in the higher extremities, upper extremities than the lower extremities. The nurse should know a premature infant with the patent ductus arteriosus will have to receive prostaglandin inhibitor, ibuprofen, intermethacin, all of the above. The answer is Indomethacin is also a prostaglandin inhibitor. Ibuprofen is a NSAID and indomethacin also NSAID. So answer will be all of the above. Indomethacin is a prostaglandin may be administered close a patent act arteries in premature infant and some new ones. Infant with which condition would have a typical sign of acute episode of hypercyanotic spills called blue spills or tet splits. Please remember, blue spills or tet splits occur when the infant oxygen requirement exceeds the blood supply, such as during a crying, feeding, and defecating. The answer is TOF. So tetralogy of Flatus means VST, pulmonary stenosis, overriding aorta, and right ventricular hypertrophy. Clubbing. What causes clubbing is a symptom of hypoxia, hyperoxemia, hypercapnia, and hypocapnia. The answer is hypoxia. So respiratory system means some patient having prolonged COPD or the condition which causes low oxygen level in the blood causes hypoxia, the clubbing. Okay, rheumatic fever usually develops after partially untreated, what is some streptococcal infection. What is that? Okay, 4 to 10 weeks of group A beta hemolytic infection, 2 to 8 week 4 weeks of group A beta hemolytic infection, 4 to 10 weeks group B, 4 to 12 weeks group B. What is the answer? The answer, all we know, it is a group A. Okay, so it is 2 to 4 weeks. Sometimes they will ask 2 to 6, 2 to 4, everything. So both answer correct. 2 to 4 weeks of group A beta hemolytic streptococcal infection. Major criteria for diagnosing rheumatic fever under Jones criteria is arthralgia, elevated ESR, elevated C-reactive protein, prolonged PR interval. All looks are very related to rheumatic fever, but answer is arthralgia. John's criteria, rheumatic fever for diagnosing two major or one major, two minor manifestation is needed to for diagnosing rheumatic fever. Then the positive throat culture of streptococcal and elevated anti-streptolysine O titer. It is necessary. So please remember anti-streptolysine O titer and the group A streptococcal infection. Coming to major criteria and minor criteria. Major criteria includes carditis, arthralgia, chorea, erythema magnetum, subcutaneous nodules. Minor criteria: fever, arthralgia, elevated ESR, C-reactive protein, prolonged period interval. So, two are one major, two minor. Okay, this is a criteria for two major. And if the patient is having two major, then it is a rheumatic fever. One major and two minor. Also correct answer only. Rheumatic fever, all we have explained. It's a bit of it's a 2 to 4 weeks. Major criteria, everything as you mentioned, some chorea, arthritis, minor fever, rheumatic fever, prolonged VNAS, and arthralgia. Okay. The nurse reviews a laboratory results for a child with a suspected diagnosis of rheumatic fever, knowing that which laboratory study would assist in confirming the diagnosis. Immunoglobulin, RBC, white BC, that already I explained it clearly. So it is anti-lipolysis. Okay. So what would be a stroke volume for a patient having cardiac output of 550 ml and heart rate is 72 per minute? So answer will be what? So stroke volume means how will we calculate cardiac output? It's just stroke volume into heart rate. Yeah, na? So answer will be 74. For example, how will you calculate? It's a stroke volume. So we have 440 and 72 stroke volume. So it's a division. So answer is 70.